Hello, I will be talking to you about chlamydia control and prevention. While most people know about chlamydia as a pesky STD that causes painful urination, it leads to serious health problems in women, including difficulties getting pregnant. The Center for Disease Control has estimated that 2.86 million Americans are infected each year. New Hampshire has low rates of sexually transmitted disease compared to the national average. In the past decade, however, the number of new cases of chlamydia in New Hampshire has doubled. The rate of chlamydia infections has been accelerating faster than in the rest of America. Estimates have found that 1 in 20 sexually active women between the ages of 14 and 24 are infected with chlamydia. Chlamydia is a common STD that infects men and women. It mainly spreads through sexual contact with an infected partner. Infected women that give birth can spread it to their infant. Chlamydia infections often appear without symptoms. Studies have found that only 10% of men and between 5 and 30% of women infected with chlamydia actually show symptoms. Men who have symptoms of the infection experience painful urination, penile discharges, and testicular pain and swelling. Women may experience vaginal bleeding and pain in the abdomen. If left untreated, chlamydia can cause pelvic inflammatory disease. This leads to chronic pain and permanent damage in a woman's reproductive abilities. Chlamydia is difficult to detect because of the lack of symptoms. Treatment of chlamydia requires antibiotics prescribed by a physician. The lack of symptoms means that many infected individuals will not seek out medical attention. This demonstrates the necessity that all sexually active people get regularly tested for chlamydia. Even though men experience less severe symptoms than women, getting tested is the responsible thing to do. If a man infects a woman with chlamydia, it can lead to a lifetime of pain and infertility. Condoms should be used during all sexual encounters, especially those outside of monogamous relationships. Condoms are not 100% effective at preventing anything, which further demonstrates the necessity for regular testing. If you do have unsafe sex with a new sexual partner, you should make a doctor's appointment to get tested for STDs. When engaging with a new sexual partner, ask if they have been tested. Check out government websites like the CDC or Health and Human Services for more information. If you have any questions regarding chlamydia, reach out to your local healthcare professional. Practicing safe sex is the best way to prevent chlamydia. Remember to get regular testing. It is the right thing to do.